Welcome everyone. I know many of you. My name is Lagali. I'm from Linköping University here in Sweden. And on behalf of the local organizing and scientific committee for this conference, I would really like to extend to you all a very warm welcome to here at the 7th European Aniridia Conference in beautiful Stockholm. I would first like to thank our conference organizers, who you will hear from soon, from Aniridia Sweden and Aniridia Europe, for making this conference a reality, and also our generous donors, including the many organizations and foundations who contributed financially also to make this meeting possible. So a big thank you, and also a special thank you to our corporate sponsors as well. And I'd now like to introduce my co-members of the scientific committee for this conference, who have been instrumental in helping to put together this great scientific program, as you can see in your programs, and that we would have high quality sessions here that will engage our doctors and our younger doctors and trainees from various regions of Sweden and even beyond. So first of all, Branka Samolov.
Welcome to Stockholm.
Senior Consultant Director of the Cornea Department at St. Eric Eye Hospital here in Stockholm. And Berit, and Berit Wyström, Senior Consultant and Head of the Corneal Section at Umeå University. And in addition to their involvement helping to organize the scientific program, both Dr. Samolov and Byström will be speaking in sessions tomorrow on keratopathy and stem cells, so don't miss it. And I'd also like to thank everyone here for coming, both from near and from far, and some have traveled from very far. It's really, I'm really grateful that you could take time from your busy schedules to come to this meeting this weekend. And also, we hope that it's going to be an opportunity to learn, to network, to collaborate, and also meet old friends and also make some new friends. Although this is a scientific conference, the EAC 2024 conference also consists of 3 parallel meetings. And we have in total 176 registered participants from 19 different countries. So it's really a very international crowd here. And it's over 3 days. And as I mentioned, we have 3 parallel meetings. We have the scientific conference here, but there's also a Nordic Aniridia meeting and also a leadership academy for those with Aniridia. So and when we have our social events, we will have a chance to come together and mingle and talk to each other. And we hope that will happen to a large degree. So, yes, so we're hoping that also in this conference that you can hear and learn from global experts in Aniridia. And many of them are here. Also, not only this, but that you can hear the latest research and potentially future breakthroughs in the field as well. And for also for the clinicians and clinician scientists, we will hopefully be hearing a lot about some best clinical practices around Aniridia that could benefit patients and patient care. And finally, we hope that this is an opportunity to also discuss issues amongst colleagues and reflect on these. So we also hope that, I hope that you will take the opportunity also to approach someone maybe during the conference who you don't know, and maybe ask them how their work or their interest is related to this conference. It's also hoped that those who are doing research, either clinical or basic research, will become inspired to continue or to deepen their research, maybe hear a new idea, or take a new direction, or find some common ground, maybe to collaborate with others here at the conference. For the medical professionals, it's our hope that you'll learn from each other and that this will ultimately improve knowledge about aniridia, but also quality of care for aniridia patients and improve ultimately patient outcomes. So enjoy the next few days, and with that, I will leave the word to our partner aniridia organizations in Aniridia Sweden and Aniridia Europe. Barbara.